Hi, this is Dr. Eric Donor at the New York Skin and Vein Center. Today I want to tell you a little bit about varicose veins and how we treat you here at the office. So first, a little bit about me. I've been treating varicose veins for approximately 10 years using the modern methods. I've treated thousands of people. We've treated men and women and all ages. I've treated a 17-year-old teenage boy. I've treated a 92-year-old ambulance driver. So nobody is too young or too old to have their legs treated. So what causes varicose veins? Well, varicose veins are more than just those blue bulging veins on the surface. They come from an abnormal vein underneath the surface. And some people with the most problematic legs have no bulging veins on the surface. They just have underlying problems. So what happens because of genetics, because of standing on your feet, because if you're a woman having babies or being on hormones, the vein walls weaken and they swell and dilate. And in so doing, you have high pressure in that vein that goes all the way down the leg. So instead of the blood being pumped back to the heart to recirculate it, it just sits in the legs where it creates high pressure. Tissues don't like high pressure. It's called venous hypertension. And so the high pressure causes aching, throbbing, cramping, restlessness, tightness, swelling, rashes, itching, blood clots, ulcerations, all kinds of problems in the legs, including nighttime leg cramps and restless leg syndrome. And so when you seal off those veins and prevent the high pressure, you stop all of those symptoms. So how do we do it? Well, for most people, it's a three-step process, all done at the same time right here in the office. First, if you have bulging veins on the surface, we mark them out with a special pen. Secondly, we clean off the leg, everything is sterile. Then we find the underlying vein that usually runs from the knee up to the top of the hip, and we start an IV in that vein, just like an IV in the back of your hand. And we feed this teeny tiny little laser fiber inside the vein. That's what it looks like. And we feed it all the way up to the top, and we numb everything up with Novocaine, and then we fire the laser, which seals the vein shut. What happens to the blood? Your body directs it to normal veins, so it actually normalizes the circulation in your leg. Remember, you have 50,000 miles of veins in your legs. You don't need this vein. Secondly, if you have bulging veins that we think are also a problem, we then numb them up with Novocaine, make a little poke in the skin the size of a freckle, and then take them out with a high-tech crochet hook. Okay, there's no cutting, no staples, no stitches. Then, if there's any other veins left behind, we'll inject them with medication to seal them shut. We'll wrap up your leg, and you'll be out the door in about 15 minutes. If we do remove veins, there'll be a heavy dressing on it that will stay on for 2 days. You take it off at home, and then you just take a shower and wear a normal support hose. If all we did was laser shut a vein, you just need to wear a support hose afterwards, and you'll be back to work and play in just a day or two, okay? And that's about it. Now, everything that I just told you is in my book, Get the Healthy, Good-Looking, Pain-Free Legs You Deserve Now. Hopefully you've gotten to read this. It's available on my website, nysvc.com. If you haven't, call the office or we'll give you one here today. All right. So this is Dr. Eric Donor. Hope to see you soon.